Yeah.
So first of all, we have to really be very scientific, and obviously there is nothing called unexplained. Everything that we don't understand is put in a box, and that box is called unexplained. So definitely endometriosis, and especially subclinical endometriosis, like I already mentioned, that because we can't do the gold standard diagnosis because it is a surgery, those patients will remain undiagnosed, and that is why a large percentage of them might be subclinical endometriosis. In one study, actually, the percentage was up to 7%. But that was one study. I don't remember on the top of my head that what percentages were attributed in various studies, but definitely it can make a significant chunk. The other significant chunk can be the problems related to immunology. There are various antibodies in the body, especially present when other autoimmune factors like diabetes, rheumatoid arthritis, or such personal or family histories present. There is another entity called problem with the natural killer cells, which is going to make an important part of the implantation process. There is another aspect of whether the body is able to make enough blocking antibodies, which is actually basically the blocking antibodies so that the mother's immune system doesn't feel that the baby is a virus or a cancer and doesn't kill it. So it accepts it. So it's very intriguing how nature has designed it, that there is a whole another body inside a body and then it is accepted. But when this mechanism fails, and when the body recognizes a new antigen as something foreign and rejects it, so definitely all those undiagnosed patients can be missed and they are again put in the box called unexplained. But I do practice reproductive immunology. There are very few doctors who practice reproductive immunology to the extent that we do, but we do it very carefully in a very rightly selected small group of patients in our whole practice. I take at least 1 hour explaining to the patient that why now they qualify for this kind of therapy, because this therapy has not gained enough evidence, because it is very expensive to do these studies, and with time we will have them, but it is not there yet. So when we have that history of repeated miscarriages and nothing is explaining it, and then we do a few tests, and then I believe in not going vertically into one thing that you just keep checking one side of immunology, but I go horizontally and I check antibodies, Th1 Th2 ratio, NK cells, DQ alpha. There are it's just it makes more sense to go horizontally and do one basic test for like endometrial immune profile. There's a new test called KIRS in which the sample goes to Chicago, and we wait for a couple of weeks, and all this. So we check a bit of every side, that is there anything wrong, and obviously it is guided by the history of the patient. For example, someone has thyroid issues or someone has massive diabetes history in the family or herself, I would think of making sure that there are no antibodies of other nature in her body. Similarly, my other decisions are guided by that. But we try to, that makes us very unique, by the way, that as a team, we try to not go too deep into one thing, but we try to check everything horizontally and find out if some area is the problem area. And then we go deep into that, depending on how, patient has to accept that this whole thing actually is not based still on massive evidence, but it is still experimental in nature. And that is the information the patient needs to know. And then she can go ahead and test more and treat more. There are various modalities. Some of them can have side effects like allergies. So it has to be very carefully selected. There are various modalities like use of intralipids or lid therapy. All those things have to be very carefully selected in a very small subset of patients only. They should be very carefully given, not to everybody who has miscarriages, for example. And there are other tests like LAD, and in which we, check the partner's blood also, and see whether there is a problem in the, HLA and the other areas. Why is the women's body not accepting the baby, especially when it's an early miscarriage and repeated, and there is no other problem. So all these patients, if not tested, will be labeled as unexplained in otherwise a standard fertility practice, which is not doing a very advanced practice that includes reproductive immunology. But I have to emphasize this, that this is only beneficial to a small subset of rightly selected patients. And not everyone should be spending thousands and grands of pounds uh, just without any genuine rationale behind that.